Hello, I'm Dr. David Levine, and today's date is April 29th, 2023. I'm in Chicago at the American Association of Plastic Surgeons meeting where I'm doing interviews for the ICON Project. The purpose of the ICON Project is to preserve in audiovisual format icons of our society who are teachers, innovators, forward thinkers, and great surgeons who advance our specialty. I hope you enjoy this. Hello, I'm Dr. David Levine, and welcome back. I'm here to interview Dr. Linda Phillips, who is presently the chief of the Division of Plastic Surgery at the University of Texas Medical Branch in Galveston. Before I start the interview, I would like to thank Linda because I wouldn't be sitting here having this conversation if it weren't for the fact that she championed this ICON project. Over 10 years ago, I ran into Dr. Verheiden at a Texas Society of Plastic Surgeons meeting, brought up the idea, and 1,000 emails later, things just kind of died down, if you will. And a few years after that, Linda sent a letter, and I remember it said, "You may have thought this project was dead, but it's not. In fact, we're going to pursue it." I immediately booked a flight to the University of Virginia in Charlottesville within a month and interviewed Dr. Milton Edgerton, who was 92 at the time, and had a wonderful interview with him, and have since then have almost 40 interviews. And I want to thank you, Dr. Phillips, for being my champion of this, and thank you for coming here today.
Thank you for all that you've contributed to plastic surgery for doing this. It means a lot to all of us and will to the generations of plastic surgeons to come.
Oh, it was my love and my passion, and I will continue to do so as long as I can.
Sounds great.
So first, would you state your full name and date of birth?
Linda Golek Phillips, 11/11/1951.
And your parents' name?
Edward and Rosemary Golek, and Rosemary Thomasek Golek, yes.
Okay. And did your mother work, and did your father, and what did he work, or what did he do?
My father was a mid-level executive for Sears Roebuck, and my mother did not work until I went to college so that the family income wouldn't be negatively impacted.
And by the way, that's not nice to say that. Every mother works. I'd rather be working than taking care of my children. My children are great, but that's a job unto itself. So it's probably not fair to say that she wasn't working. She was working.
I should say she worked out inside the home until college.
Okay. Where were you born? Chicago?
Chicago.
Okay. And you've been in Chicago your whole life, basically.
I was.
Until you left.
Until I left to go to Wayne State. And then that was in 1984.
Okay. And how many children and grandchildren, if you want to mention their names?
Absolutely. Grandchildren are the reward you get for not killing your children when they're teenagers, or at least living through and being on good terms. So we have 4 children. My husband and I have Cooper, who is married to his classmate, Rebecca, and they have 2 children, Sullivan, who is 8, and Gideon, who is 6. And then Nolan, who met in grad school, his wife Liz, and they have our granddaughter, she's 2, Penelope, our son Spencer, who is currently a graduate student at Wake Forest in biomedical engineering, and then our daughter, who is married to Winston Nicholson, Corinna, and they are in Manhattan. She's a modern dancer.
Oh, wow. Wow. Interesting. And how did you meet your husband?
Classmates. We met actually at a mixer, and we met and we were part of a group, and we hung out together because no one wanted to hang out with the first-year medical students because we all smelled like the formaldehyde from the lab that we were in for cadaver dissection every afternoon. And we're a large group, and it became more than friendship.
I understand, because I remember the first anatomy lab, I couldn't get that smell out of my nose. It seemed for a year.
Yes.
Yes. That's an experience unto itself. And what inspired you to go into plastic surgery? And tell us about your mentors, if you would, referable to that.
So I was not rotating through plastic surgery in a clerkship, but I knew when I was planning to pursue general surgery that I wanted to do something a little bit more narrow and a little bit more refined. And I was thinking of vascular. I almost went into cardiothoracic surgery. But we had a lecture from Marty Robson, and it was just intellectually riveting. And it started my interest. And then when I rotated through his service as a second-year resident, I knew that this is what I wanted to do.
Yeah.
And Marty was my lifelong mentor.
And good, and that was kind of what I was going to get into the next part where your mentors, but we'll talk a little bit more about it. I just want to add that in this day and age of 2023, a lot of people have the wrong idea about plastic surgery. In her meeting with Dr. Gillies, and people, she didn't understand until she got into this really what plastic surgery was about. And I went through the plastic and reconstructive and how that's really part of our being. And
it's part and parcel. It's a woven fabric.
Yes.
To do reconstructive well, you have to have good aesthetic tenets, and to do aesthetic well, you have to know what the pitfalls are and how to get yourself out of it. So you have to have reconstructive.
Exactly. Yeah. And it's as the old saying goes, if it was that easy, everybody'd be doing it. And I agree with you that understanding the base of what we do and how we've gotten to the cosmetic part, the reconstructive was the basis of all that. And that's so important. And that's what you teach, obviously.
Yes, and that's what sets us apart from those who would like to do some of the cosmetic procedures but don't have the background that we do.
Right, right. Now, look, we've seen and you've seen momentous paradigm shifts in plastic surgery during your career. And would you just talk a little bit about that?
So it's gone from being almost universally a 5+2 or 5+3 to a large proportion being an integrated program where it's run by the plastic surgery group instead of running most of it through general surgery, spending 5 years doing that. And so that's a big change in our education. There's been a huge change in the amount of micro, which had started just as I was getting in, but really has taken hold for so many things beyond what it originally was. And then there are all these new techniques with laser surgery, using lasers not just for aesthetic reasons, but also for ablation of tumors and for scar work. Fat grafting, which was once denigrated as being something we shouldn't do, now being uniformly accepted and used more and more in reconstructive as well as aesthetic techniques. Those are just a couple. Well, and then of course transplantation. Although it's ironic because Dr. Murray was, given a Nobel Prize for his work in transplantation, but plastic surgeons got away from that, and now we're doing hand and face transplants. So. Right.
The wheel has come full circle, as they say.
Yes.
Yeah, most people don't understand that. In plastic surgery, that what we were involved in, what Dr. Murray did was groundbreaking, and I forgot where it was one time, but I was talking to somebody that they were selling a book, and they said they got a Nobel Prize in plastic surgery. And I had a 5-minute argument with them, and then realized I was going nowhere, that there was only one plastic surgeon that had received the Nobel Prize for his work. And of course, that changed the history of medicine as we know it, and it continues to change. And this may segue into what I'm going to ask you, but what did you feel the most important innovation in our specialty has been? Would you it may just be what we talked about, or you may want to elaborate on something else?
So I think transplantation actually began well before I got into the field. So I wouldn't say that was, although it's extrapolation into more plastic surgery areas like hand and face is momentous. The use of grafting, fat grafting, and then tissue engineering. I think tissue engineering will be where we go in the future. It has a lot of benefit that's a promise for the future, and I don't think we've nearly touched on what that can do.
What has been your greatest professional accomplishment?
My clinical work is very rewarding in that I've been at the same place for so long that now mothers are bringing their daughters to me for their breast reductions. And I've got whole families that are having that. And it's quite an honor when somebody brings their family member back to you after they'd been your patient. I'm really enjoying doing paniculectomies to prepare patients for kidney transplants, because we know that heavy pannus puts them at increased risk for wound dehiscence and infection. And when they're given this blast of immunosuppressants, they're even at greater risk. So helping somebody to get to their kidney transplant is kind of, in a way, continuing what Dr. Murray had done.
Yeah.
So that's very rewarding. From a larger standpoint, nationally, helping to move the needle some, helping to, as Deb Johnson called it, melt the plastic ceiling. I think that makes me feel good. I find it easier to champion those behind me than work for it myself. But I think that because of some of the things that many of us did, and I'm one of them, it is a more supportive environment in plastic surgery programs, both for the residents and the faculty, and more family friendly, which I think makes it more sustainable.
And you're the third female president in the American Association of Plastic Surgeons, McKinnon, McGrath.
And then me.
Yeah, okay.
Yes.
And I interviewed Dr. McGrath a few years ago, which was an honor and a privilege. And I get what you're saying, that, you know, that the plastic ceiling versus the glass. But at this point, it's interesting. When I went to the University of Virginia, 8 members of our class were female. Now 50% more, actually 55, 60%. So the demographics have changed, and deservedly so. But it's just interesting how we've seen changes occur like that. Now that's part of everything. It's not as unusual.
No. I was part of a class of 104. There were 22 women. We were the biggest class of women that had yet been at the University of Chicago. I was the first woman to complete Marty Robson's plastic surgery program. Now, in our program at UTMB, the incoming class will make it 18 women out of 24.
Wow.
Yeah, I think we're skewed because of leadership and other, well, not just mine, obviously, but Julie Park, And soon we're adding a woman hand surgeon and a woman aesthetic surgeon, so it'll be 40% of our core faculty will be women. But we also have a reputation for being family friendly, and many of my residents have taken advantage of the time juggling that we've done to let them have children during the residency, since we know that fertility and complications rates go up rapidly during the time that they're residents. And then also, this is the first year that plastic surgery is 52% of the incoming PGY class are women now. We're the only surgical specialty other than OB-GYN that has had that mark.
Wow. Well, when I just attended my 50th reunion, and one of the few female students said when I interviewed, she went to San Francisco to be a pediatrician, and of course this was a different day. They asked her, "Are you going to have children? How do you plan to fit this into your life?" Now it's taken that, hey, this is part of life, and it's I won't say it's more accepted. It's the norm now, as described in your numbers. This is where we naturally evolved to.
But those questions are still being asked.
Oh, really?
Even though they're considered illegal, even though we're told not to use them. I made that same comment in a meeting 5 years ago, and it got really quiet. All of the women residents and students didn't say anything. And I looked around and I said, well, what is it? And finally, one of my residents spoke up and said, those questions are still being asked, Dr. Phillips. Wow. So, yeah, it's still out there. And it's worse for the men and women of color. They're getting questions like, what do you plan to do? Well, you know, the place that I came from, we didn't have a program. I want to go back and be the first woman, Black program director at my medical school. And she was told, well, that's nice, but you know, a lot of women aspire to academic roles and, you know, they drop out. And she immediately reeled off a couple names and said, well, what about, and what about, and what about? And they just said, yeah.
Well, okay, so sometimes things aren't as changed as you thought they were. Exactly. Well, you're a champion, so you'll continue to espouse that philosophy, and that's great. And that's why you're here today, because you're an icon. And I'm not finished yet. I got another question for you. As a chief of a program, I've never asked this, but I've thought about it. How much time do you do administratively versus actual surgery?
I'm in a weird position in that because I do so much breast surgery, I've had several breast surgeons leave, and then I tend to get their patients. And so right now, I'm operating 3 days a week, and I'm in clinic the other 2 days.
Wow.
So
that's a lot of time.
So my admin is in the evening, or, you know, between the morning and afternoon session of clinic, or whenever I can grab that time.
Yeah. Okay. And what do you think that our greatest mistake as a specialty has been? And if you don't think there are any, that's fine. I like to include that, what your philosophical thoughts are. I
think that we need to be careful because we are the innovators, and our ideas are picked up, our procedures are picked up by other types of disciplines. And we need to be careful not to be perceived as doing a turf battle. As you were saying when we were talking earlier about the melding of aesthetic and reconstructive principles, we are the only ones who have that groundwork. Others who pick up, oh, this sounds like a good idea, so I'm going to spend a weekend course and learn how to do this, don't have that groundwork. So what we need to do, and we, I think, began to learn this when we had the discussions with the facial plastic surgeons, is that we need to emphasize patient safety and good expertise on the part of the surgeon. And if we do that and we hold out for excellence and safety, then other groups won't perceive us as simply trying to mark out our turf. And our mistake has been to do that in the past, but we've learned from it and we're much stronger, I think, as a result, and our patients are better off as a result.
And I want to tell you, I would say of the 40 interviews I've done, that's come up more commonly than you would think about our turf battle issues that really shouldn't have been turf battle issues, because in reality, patient safety and care and results are what's important, not what part of the field do we own, because we never own anything like we think we own it. So
right.
I think that's important. And if we want to include somebody else, when I say include, but somebody else interested, I agree with you. The worst thing is somebody that takes a weekend course, puts a shingle out and says, I'm now a specialist in this. And you know, with social media, it does, and this is one thing, this isn't about me, but my observation is the old, go to the emergency room, do the reconstructive cases, build your practice. Now they come out and they're experts because they've hired a social media expert to promote them. And I think they've lost the fun. And I hope eventually it gets back to what it was, where they want to take emergency call, they want to do those reconstructive cases, because that's what challenges us, in my opinion.
And makes you grow and gives you a lot of experience. Dr. Murray, when he was given, I think it was the Distinguished, but a particular award that recognized all of his contributions from the American Society, he included the comment that we should not forget our background, because the patients who have the needs for wound care, wound healing, need us, and we're the only ones who can do that.
Yeah, I agree. What has been your greatest professional disappointment? And you may have none there. These are part of my questions, so I'm not pointing. What do you think?
Oh, it was really hard for me to talk about. In fact, it's only in the last few years that I've been able to use it as a tool to instruct others that you can have a major failure, but it's about picking yourself up again and moving on. And that was that I was cut from the general surgery residency program at University of Chicago. And I was taken...
It was a pyramid program.
It was a rectangular program until that year. We were not told it would be different. We thought it was still a rectangular program until we were in an orientation meeting, and doing the math, there were way too many of us. So I was a married couple, and so it was assumed that I would not pursue much academic pursuit. It was very hard at the time. Dr. Beal, who was chair at Northwestern, became an immediate mentor, championed me. We kept in touch until his death. He followed my career. He would handwrite me a letter periodically. And it was a great experience having something else in general surgery and seeing how things were actually quite different between the two academic programs. But it also made me determined to prove them wrong. Mm-hmm. So it kind of helped to stimulate me to do some of the things I've done.
Oh, great. Well, what's been your greatest joy, in personal or professional?
So there's lots of joy. I'm a very happy person. Professionally, seeing my former residents become one, Lou Strock, president of ASERV, one, Jennifer Walden, just completed serving as president of the Aesthetic Society, first woman. Others like Brad Wilhelmy becoming a chief at their program. So seeing them doing well and happy in a very prolific cosmetic practice, they're happy, they're doing well. Yeah. I'm happy for them. And then my children, seeing that they're happy in their careers. I didn't mention my second son actually is a sociology PhD who's a consultant at Accenture and works on the government side.
Wow.
My son, who is an anesthesiologist, is program director at Texas Tech in anesthesia. My daughter is determined not to let the pandemic get in her way, and she's back dancing and having performances again.
Where is she in New York? I've just got to dig
Manhattan.
in.
Manhattan is the hotbed.
No, I mean, but is she in a particular school, or is she now just in the process of getting jobs and dance?
She's working regularly with Take, and she's part of the company for Tabula Rasa.
Okay.
And she was with another company that opened their building for education and performance in February of 2020. So it folded when the pandemic hit.
Okay.
And then our son, who decided not to be a teacher in languages and went back to school, starting from square one in school, going from a BA to a BS, master's, and then now he's in a graduate program.
Wonderful.
So, and they're all really good friends. I mean, during the pandemic, they would Zoom to watch Arsenal because they're big Arsenal fans, and they go periodically to visit our daughter, who could care less about sports, but it's a great place to meet in New York, and they all get together.
Right.
And so that's a piece of pride for me, that they're happy with their relationships, their marriages, their kids, their jobs are their passion, not just a job. And then that I've been honored to be the leader in a number of our national organizations, particularly the American Board of Plastic Surgery and most recently the American Association of Plastic Surgeons, where I was somehow able to be the president for the centennial. What a joy that was.
Yeah. I remember that was last year, right?
Just last year.
Yeah, I remember you. Yeah, that was, yeah, and I've been privileged to kind of watch that part of the association and their growth and everything, which has been fun for me.
Oh, you've been a great part of that, a huge program leader.
Yeah, I love it. Well, my next question is, well, who do you admire most, professional or personal?
So, from a mentoring standpoint, it would be Marty Robson. He was my lifelong mentor until his recent death. The fact that so many people from everywhere he was, whether it was back when he was a resident at Yale, as a young faculty member at University of Chicago, more seasoned at Wayne State, UTMB, and then South Florida. There are people who wanted to know how they could contribute, how they could help to memorialize him, and that says a lot about his character. He gave a lot of help to many of us, and our careers were better for that. And I think in many ways, plastic surgery was better for that. From a professional and personal standpoint, you have to give a lot of credit, and I've enjoyed my friendships with Susan McKinnon, Carolyn Kerrigan, Deb Johnson, and Mary McGrath. Those are only a few. I'm very thankful to the woman cardiothoracic surgeon who, when she noticed that I was obviously pregnant in residency, sat me down and gave me pointers about how to meld the personal with the professional, being a resident in general surgery at the time, Renee Hartz. And so there are many people, and I'm skipping some who have been tremendous help to me because it's a very long
Well, it's
list.
hard to get,
It takes a village.
But yeah, that's right. And so the next question, a little bit different, but the same concept is, what words of wisdom would you give to present and future residents in plastic surgery?
So I would quote 3 people. So everyone's original mentors are their parents. My mother always said, be true to yourself. My father said, always do your best. And then I would quote Marty, who always expected that we would do our best. But he also would quote Gertrude Stein. And I still, to this day, quote this to my residents. A difference, to be a difference, must make a difference. And if you remember those tenets, you'll work within the context to be yourself, to be your best self, and to give your best self to your patients, to your residents, to your families.
Okay. As we round out and finish this up, I would like to know what you think plastic surgery will be in the next quarter century. Predictions, actually, of where we're going. I mean, you mentioned stem cell, cell structure, whatever, but
tissue engineering.
And tissue engineering.
Yes.
Thank you.
I think we'll be much more technologically oriented, perhaps a little less invasive or more minimally invasive. A lot of what we do can't be. You know, when you're talking about body contouring after massive weight loss or breast reduction, you've got to have large incisions. But I think there are other things that we can do with much smaller incisions than we've done. And I'm sure we'll get on the bandwagon with that, like other disciplines have done, more robotic surgery. The global portion of what we do has always been a passion for many of us, and that's growing. What we're beginning to do in Rwanda is amazing, in Vietnam, and I hope we never lose that heart, because that's been an important part for plastic surgery in general. Not to be the rock stars of aesthetic surgery. Nothing wrong with that, but that's not the only thing that we do. And we touch lives, we change lives forever in what we do, whether it's aesthetic or reconstructive surgery, in both areas.
And you mentioned Marty Robson. I believe I've done an interview with him.
Yes, you
Thank
have.
goodness.
Yes.
Which is kind of the purpose of this project. And do you have anything else that you'd like to mention? We're at the end of the interview, but anything that you'd like to say?
I would say that plastic surgery is an exciting field, and we plastic surgeons are very fortunate to be plastic surgeons. Many of us find retirement difficult or delay it because we have fun. Maybe not every day, but almost every day. It's not a job. It's not work. It's a career, a profession, a calling. And we have a lot of good friends who are a lot of good people.
Well, Dr. Phillips, this has been an honor to interview you, and thank you so much, and thank you so much for your help.
No, thank you for doing these interviews. You do them so well, and it will mean a lot to the people in the future, because if we don't learn from history, we will repeat it.
Santiana.
Yes.
Thank you.
Thanks.
Thank you. Thank you so much, and I hope you enjoyed this interview. All of my interviews are available online at meeting.aaps1921.org. I'll repeat that. meeting.aaps1921.org. And thank you.